I think cell phones and laptops really are some of the killers for our current society. I mean, I love my cell phone and I love my laptop, but it is tough. And so, you know, when you think about the positions that you have to put your body into to operate those pieces of technology, it really is not structurally beneficial. And so, for sure, I see a lot of patients with kinks in their necks, or, you know, they talk about mostly upper cervical or upper thoracic, I think, is related to that laptop use or cell phone usage. And so the first thing that I always tell patients is, you know, of course you're going to have to work on some PC or computer at some point in your life, but you really need to make sure that ergonomically you're set up for success. And usually that starts with the low back. And so, you know, wherever you're, you know, having a good chair or a good device that you can sit on is key. And so you want to make sure you have a good chair. That's the first thing, with lumbar support. If you don't have good lumbar support, they sell very inexpensive lumbar support pillows on Amazon, or really at any drugstore. And so those lumbar support just go in the low back, and the idea is that we're kind of pushing the lumbar in and straightening our back up so that we're sitting up in an anatomical or more anatomical position. So sitting up straight with that lumbar support. So that's number one. The second thing is that we want to make sure our workstation is at eye level. And so the killer with the laptops is always the keyboard is down here and the screen is down, and so automatically your gaze is coming down. And so if you're doing that for 10 minutes, that's fine. But if we're on that laptop for 8 hours a day, I mean, you're just purposefully slumping over, and it's just not going to be healthy for your spine. So you have to have something that kind of elevates that. They make these amazing stand-up desk modular trays where they kind of can raise and lower, and I think those are great. So for patients that really struggle with this but have to obviously work on a computer, you know, going from a sitting to a standing position every 30 minutes where they can kind of elevate and change their position and then get back down, but trying to keep that computer at eye level is really, I think, critical. And then I also think that, so then with the cell phone, it's like, you know, we used to do a lot of this, even with the corded phone and this. And you know, I mean, nowadays it's so easy to get a hands-free device, whether it's an earpiece or a cord, or, you know, you're using the speaker. And so I always tell patients, like, let's get off of this and let's do hands-free, just so we're more natural and not putting our neck into a kinked position. And then the final thing is, I think that sleeping is so important, you know, and so, I mean, I love my sleep, and so I try to sleep healthy. And one of the ways we can help our neck specifically sleep healthy is an orthotic pillow. And so that's also an easy solution to kind of put our neck into an anatomical position while we're sleeping. And these orthotic pillows simply have a cutout for the head, and they kind of support the neck while we're sleeping. So during that 6 or 10 hours when you're sleeping at night, you're kind of putting your neck back into a more anatomical position and letting it heal and realign. And so I think that can be a real game changer for a lot of patients too.